Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I'm so glad to be back in our sunflower house. On this episode, we're going to talk about breast cancer and menopause. I'm sure, as a lot of you know, October is the Pink Ribbon Breast Cancer Awareness Month. So for almost 4 decades, the United States has recognized October as a National Breast Cancer Awareness Month. So it's a time that's devoted to educating and empowering people about breast cancer, because 1 in 8 women will be diagnosed with breast cancer in their lifetime. And the 2 most common risk factors for being diagnosed are being female and getting older. And that's true for a lot of cancers. Age can be certainly a significant risk factor. But it's important to talk about whether there's a connection between menopause and breast cancer, and what women can do before menopause and after menopause to reduce the risk of developing cancer. Particularly what we're most concerned with is dying from cancer. And what I always like to emphasize is that most women with breast cancer die from all the same causes that other women die from, primarily cardiovascular disease. And if you haven't listened to one of our earlier podcasts on breast cancer survivors and treatment of genitourinary syndrome of menopause, that's a must listen to. And really, all women over 50 need to prevent GSM, genitourinary syndrome of menopause, because it has so many effects on the genitals, bladder function, vaginal function, the whole pelvic area. So in and of itself, menopause per se is not associated with an increased risk of developing breast cancer. However, the rates of many cancers, as I mentioned, including breast cancer, do increase with age. In addition, some of the drugs used to manage menopausal symptoms can decrease a woman's risk and may also potentially increase the diagnosis of breast cancer. Not death, but diagnosis. So let's go over some risk factors for breast cancer. Certain factors increase the risk, and some can be changed, such as lifestyle choices, but others cannot be changed. You cannot change your age, and you cannot change your family history. But having a lot of risk factors doesn't mean a woman will definitely develop breast cancer. And conversely, having no risk factors doesn't mean you throw caution to the wind and that you will never develop the disease. That's not true. Number 1, age. Age is an important risk factor for breast cancer, and it does increase with age. 70% of the women diagnosed with breast cancer are over age 50, and almost half are over age 65 or older. Family history is another risk. The personal risk is greater if you have an immediate family member, like a mother, sister, or daughter, particularly if it was at an early age under age 50. And there is a genetic test for the mutation in BRCA gene that screens family members who are at higher risk for breast and ovarian cancer. And certainly if you've got Ashkenazi Jewish ancestry, it's recommended to be assessed for genetic testing. And as you'll recall in one of our earlier podcasts that I did with medical breast specialist Dr. Holly Peterson, the recreational genetic testing that many people do through Ancestry&Me and 23andMe are not medical genetic testing. And if your testing suggests negativity in the recreational genetic testing, you cannot take that to the bank. Okay? That's a very important point. Also, if you had genetic testing done prior to the fall of 2013, which is a whole decade ago, it needs to be repeated. And we continue to have advances in checking for some of these large genes, and we're looking for the smaller and intermediate genes and so-called SNPs, and those affects the polygenic risk score on breast cancer. So, women who've had breast biopsies, particularly removal of breast tissue that shows certain types of benign disease such as atypical hyperplasia or LCIS, which is lobular carcinoma in situ. It's not cancer, it's just LCIS, but that does confer an increased risk of breast cancer up to 6% in the next 5 years. Having breast cancer in one breast may lead to an increased risk of development of breast cancer in the other breast. Having a late menopause, which is good for lots of things, including a longer longevity, can increase a woman's risk of being diagnosed with breast cancer. Just like early menstruation starting before the age of 10 may as well. Childbearing is very, very important. If women had children under age 18 and had multiple children and breastfed, the risk of breast cancer would be dramatically reduced. But with today's modern society, obviously that is not practical for the vast majority of women. But it's very important to understand that pregnancy, childbearing, and lactation matures the breast to a more resistant breast. And if you have your first child after age 30, it increases the risk, whereas reducing the risk if you have it under age 30. And I was so happy. I tried for years to become pregnant. I was so happy to give birth before the age of 30. Although that's not magical. You can have a baby before the age of 20, which is even better for the breast, and still be diagnosed with breast cancer. But I don't think a lot of people understand the benefits that pregnancy and breastfeeding have. So never having a child increases the risk. Never breastfeeding, especially premenopausal breast cancer. Breastfeeding is very important. And I know several mothers who were diagnosed with breast cancer at a young age, some even during their pregnancy, and had to undergo treatment during pregnancy and had to have surgery on the affected breast afterwards, and still managed to lactate and breastfeed their baby with the other breast. A big lifestyle factor is gaining weight or being overweight, and that is a big problem increasingly. So is a sedentary lifestyle. Exercise is very good for reducing several types of cancers. Excess alcohol or tobacco. You really should not smoke, and probably there's no safe limit for alcohol, so if you're at increased risk or have genetic predispositions, I usually recommend you forego it. Certainly if you're a social drinker, I would limit it to no more than 3 to 5 drinks per week. Dense breast, and you can find out if you have dense breast by your mammogram report, and that simply means you have a lot more breast tissue compared to fat tissue. Dense breasts have more breast tissue and also are denser, so it's harder to actually get good views of the breast with screening mammography. Poor nutrition and low vitamin D. Vitamin D is not a vitamin, it's a prosteryl hormone. If you haven't listened to, I think, my 3rd podcast on vitamin D, that is so important. And when I see women, most of them over 40 who live in northern climates, are all very low in vitamin D unless they take a separate vitamin D3 K2 supplement. And that is something that you can do. Smoking. It's never too late to stop. Smoking increases so many health diseases, including breast cancer. So you ask, is there a link between menopausal hormone therapy, birth control hormonal therapy, and developing breast cancer? So it's not proven that being exposed to menopausal estrogen progestogens increase the risk, certainly not of dying, but being diagnosed, it may be slightly increased to about 1 extra case per 1,000 women after 10 years of use. And so when you multiply that low absolute risk to a person's baseline risk, it doesn't usually change the risk-benefit equation. And since we know that menopausal hormone therapy is associated with longevity and also reduced symptoms and reduced diseases, I'd kind of describe it to women as it's just part of being female, feminine, and you're kind of continuing that by at least giving some of the estrogen back. And estrogen alone in women who don't need the progestogen, who don't have a uterus, reduces the risk of breast cancer diagnosis as well as death rates and several other conditions well into a woman's 70s. So if you don't have a uterus and you feel good on estrogen, and if you're over 65, if you're on transdermal estrogen or a lower dose that's not associated with an increased risk of stroke, there's really no reason that you have to stop. And this is one of the biggest misconceptions that I deal with daily. And I am part of a nonprofit group, AHA, Advancing Health After Hysterectomy, headed by the wonderful Dr. Phil Sorrell, an emeritus professor of psychiatry and OBGYN at Yale. And you can catch my interview with him for our medical CME podcast that anyone can listen to earlier this year in the late winter or early spring of 2023. And if you're on our website, speakingofwomenshealth.com, you can just search for menopause, Dr. Sorrell, breast cancer. We have free breast cancer treatment guidebooks. We've had lots of different podcasts that touch on the breast. Now, a lot of women want to know about how is breast cancer diagnosed. Well, we like to pick it up early when it's still quite localized in the breast, because that generally improves the chances that our treatment will be successful. And the survival rate from breast cancer certainly increases when it's detected and treated earlier. Part of this, though, is that over-imaging of the breast may overdiagnose breast cancer that would never affect a woman's lifespan. And once you're diagnosed, once you have that mammogram and get that callback, which so many women get callbacks because a screening mammogram can only look at 2 views of the breast. And a lot of times, the radiologist needs the breast to be compressed or spread out or imaged from a slightly different angle. And it's insurance fraud to do multiple views. You can only do screening for someone with no symptoms, 2 views. And that's why when you get the callbacks, which I know is so frustrating to so many women, because it makes them anxious, they have to wait for an appointment to get the callback. They start to think about all these negative things, which does not do them or anyone any good. Keep positive thoughts. That's so important. And if you are diagnosed, we cannot tell by looking at the diagnosis under the microscope if this is something that's just simply overdiagnosed. And it's very similar to prostate cancer screening in men. There's an older gentleman that I know very well who was in his 80s and wrote to tell me that he had prostate cancer, and I called him up and I said, "What are your symptoms?" "Well, I didn't have any symptoms," he said. I said, "Well, then how do they know you have prostate cancer?" "Well, because they did the blood test." And I thought to myself, oh my goodness, you should never do a PSA blood test in an older man who has no symptoms, because most older men are going to have abnormal results. And if you go around biopsying the prostate in an older man, invariably you're going to get, quote, a diagnosis. And that's the same in older women's breast, which is one of the reasons why the American Cancer Society recommends screening mammography every 2 years in women over age 55 to up to 75 to help reduce those false positive rates. But once you get that diagnosis, you're usually off for surgery, possible chemotherapy, possible radiation. And from my perspective, one of the worst things is being taken off of menopausal hormone therapy, because we know that helps symptoms, it reduces diseases, and is associated with a longer lifespan. So if someone's already been on hormone therapy for a decade or so and they're not having hot flashes anymore, we certainly have other things to keep the bones healthy and the vagina healthy. And some women never have hot flashes. And now we have non-hormonal options, particularly the exciting candy neuron inhibitors, which I talked about extensively in my CME podcast, and how elegant and effective that class of non-hormonal medicines are. But sometimes once the train is out of the station, it's on its way. And that's why when I have older, healthy women who are 80, 85, 90 calling me, asking me for their mammogram orders, "Do you have symptoms?" I ask. No, they don't. "Why are you wanting a mammogram?" "Well, because I'm healthy and I'm traveling to Europe next month and I'm doing this and I'm expecting my 3rd great-grandchild," which is wonderful. I love it when people have vibrant, long, healthy lives. And I try to keep people in that situation. So if you don't have symptoms, especially if you're over the age of 75 when you've graduated from screening mammograms, it's my medical opinion and many others that unless you have symptoms, you don't want to necessarily have needless imaging. That being said, if you have symptoms or you feel something, you can be 105 years old and we're still going to take care of you. And if there is a breast cancer, we're going to want to treat it with lumpectomy and local treatments. And what's really exciting is that so many women get such great management. And even women that have metastatic breast cancer, the improvements in therapies are so dramatic that many people can just expect to live a full, vibrant life. So since most every woman starts getting mammograms, some get baseline starting at 35 if there's a family history, most by 40, certainly by 45. I do have some patients who don't want anything until they're 50, and then they only want it every few years. So again, we respect a patient's wishes, and we try to do as much individual risk assessment as we can. The detection of breast cancer when it's just in its very earliest stages before it moves outside the breast is important. And the survival rate from breast cancer certainly does improve when it's caught early. Now, some of that may be those 30+% of women that are kind of falsely diagnosed with a cancer that wouldn't otherwise affect them. So, but we don't know. You can't sort that out. So that's why I am cautious about the risk of imaging, because over-imaging may overdiagnose. But you do need screenings that are individualized to your profiles, your personal risk assessment, as well as your preferences. I mean, one size does not fit all. And so that's why it's important to have a conversation about breast health with your physician or advanced practice clinician. So a lot of women ask, when should I get a mammogram? And so there's lots of different specialty organizations, and they have released breast cancer screening guidelines. It's changed sometimes over the years. This is based on evidence, but also opinion. There is differing opinions on when to start and how often to screen. And at the Cleveland Clinic, there's breast imaging, internal medicine, specialty women's health, family medicine, and medical surgical oncology. And they're recommending, in general, shared decision-making with physicians to decide when to start and how often to screen. Women should be afforded an opportunity to start screening mammography at age 40, and certainly for women between the decade of 45 and 55, we do tend to recommend annual screening mammograms, best done after your period if you're still menstruating. For women ages 55 and over, you can transition to a every 2 year if it aligns with your preferences. Some women do decide to continue with annual screening, and at our institution in the region, after 3 p.m., a couple days a week, women can walk in and just get a mammogram without even having a doctor's orders. And all women should discuss with their physician when to stop screening mammograms. And for the average woman, that's around age 75. For some women with serious competing medical conditions, they may actually choose to stop a little bit sooner. Also, having these kind of discussions about colon cancer screening is also important. And it is important to have that shared decision making. I mean, when I started when I was younger, it was kind of drilled into our head, yearly mammogram, so much so that I think some women think that the mammogram is therapeutic or preventative, which of course it's not. It's just a diagnostic test, and one that has flaws. And I remember not actually agreeing to give prescriptions unless someone had a mammogram. And in retrospect, I'm very embarrassed by that, because it's your body and you can make informed decisions. Now, a lot of women are afraid about the radiation content of a mammogram, which is generally extremely low. Now, if you're choosing to have tomo or three-dimensional mammogram, that is more radiation, more expense. I think insurances are better about covering it. And women who get frequent callbacks and the anxiety and the weight of coming back for diagnostic mammograms may want to consider the three-dimensional mammograms. But it is more radiation. And even with a three-dimensional tomo mammos, I still see many women getting called back for extra views.
We'll be back after a quick break. Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
Now, women who have had breast cancer in the past, or have had chest radiation, like from Hodgkin's disease, or have known genetic mutations and a much higher risk of breast cancer, they should get yearly mammograms, and they're not really transitioned to it every 2-year interval. And they also may need breast MRIs or other interventions. One thing that a lot of women ask me is, well, I don't want a mammogram. Can I just have thermography, which is a temperature kind of gauge? But by the time a tumor has grown and it's increased its blood supply enough to pick up the heat of that, it's much farther along than we want. So those are not recommended. Other women will ask just for screening breast ultrasound. Again, that is not recommended, and at our institution, they won't do it. They will definitely do breast ultrasound in conjunction with diagnostic mammograms, especially for looking at locations of cyst and fibrocystic breast. So we're going to now talk about, can you prevent breast cancer? And we generally consider most increased risks to be out of our hands, like a familial genetic mutation. But even so, even if you have that genetic mutation, you can help yourself in several different ways. And a lot of them are things that we've already talked about. And it's been estimated that at least a third of breast cancers can be preventable. So staying healthy does take some work. And if you're listening to the Speaking of Women's Health podcast, which you are right now, you're in the Sunflower House with your host, Dr. Holly Thacker, you are probably already committed to being healthy. So, number one, know your family history. And with Thanksgiving coming around the corner, it's time to be with relatives. And even though people don't want to talk about medical illness necessarily, knowing your genetic family history is very important. Because if you have a first or second degree relative who was diagnosed with breast cancer under age 50, that alone doubles your risk of breast cancer. And pathogenic variants, or so-called genetic mutations in high-risk genes, can increase the risk of breast cancer up to 85%. So it's good to know about your blood relatives. You also want to not just know about breast cancer and ovarian cancer, but also pancreatic, prostate, colon cancer, also potentially thyroid cancer, brain cancer. So if anyone in your family carries one of these mutations, you need to talk to your family doctor or your internist or your gynecologist or your specialty women's health clinician about getting referred for genetic testing. Now, the American College of Gynecology, as well as the National Cancer Care Network, NCCN, recommend screening breast exams every 1 to 3 years at age 25, yearly by 40. Unfortunately, the clinical breast exam is not that sensitive or specific. But I think for a woman to get to understand her breasts and examine herself once a month, particularly after menstruation, is not a bad habit. So maintaining a healthy body weight is very important because so many adults have BMIs that are elevated. And out of women older than 20 years of age, many are in the obese range, which really does increase not just breast cancer diagnosis postmenopausally, but also mortality. And there's a lot of exciting options and therapies in weight reduction. So if you haven't listened to our prior podcast on weight, including my CME interview with Dr. Tara Iyer, who trained in our specialty women's health fellowship, went on and got her obesity boards, that's a must listen to. Intermittent fasting is anti-aging and reduces insulin levels. So obesity increases the risk of several cancers: breast, ovarian, endometrial, colon, rectal, thyroid, stomach, pancreas, prostate, gallbladder, and multiple myeloma as well. So, those are big concerns. And I hope that learning about some of the lifestyle issues and the genetic issues and the kind of overinflation of the concern about menopausal hormones causing breast cancer, which is far from proven. Actually, in the Women's Health Initiative, the placebo group actually had a much lower than average risk of breast cancer, which pretty much skewed the results. So when I counsel women about the risk benefits and alternatives to menopausal hormone, the breast actually doesn't weigh that much into it. It's mainly the symptoms, the risk for cardiovascular disease and osteoporosis, the psychosocial functioning, the brain fog, joint pain, dry skin, dry eyes, dry vagina. So many women can be very miserable postmenopausal. Now, not everyone is different, so everyone has to be individualized. So you might ask about obesity, why does it have such a negative impact on cancer risk? Because some of it has to do with our body's response to fat tissue, because it makes inflammatory chemicals and hormones that reduce your body's ability to fight off the cancer cells. And it can even increase the likelihood that the DNA changes, which promote cancer when the cells divide. Exercise. Well, we've long touted the good effects of exercise, and it should come to no surprise that it helps reduce heart disease and diabetes. The American Cancer Society recommends 30 to 60 minutes of moderate activity 5 days a week to reduce postmenopausal breast cancer. We've talked about why you need to avoid tobacco products. There's 70 different carcinogens in tobacco. And women who started smoking 10 years or before the delivery of their first child have an 18% increased risk of breast cancer than those who never smoked. Some data suggests less than 10 years of smoking is not associated with an increased risk, but for many reasons it's recommended never to smoke. It also is expensive, gives you bad breath, and increases facial wrinkles significantly. Limit or avoid alcohol, because alcohol is a carcinogen that's probably attributable for about 6% of all cancers, including breast, colon, mouth, throat, voice box cancer, esophagus cancer, liver cancer, and stomach cancers. In fact, related to the mouth and throat, I don't recommend that anyone use an alcohol-based mouthwash at all. I think a 1% hydrogen peroxide gargle or a 1% providone iodine rinse of the mouth is virucidal and does not contain any alcohol. So probably 12% of all breast cancers and at least 11.3% of breast cancer deaths are linked directly to alcohol. So I know that's a lot, and sometimes we can't always do everything that we want to do, but knowing this information, I think, empowers you. And the first thing I tell women, and I get calls and messages almost every day when I'm in the office that someone gets a call back. And I have just routinely told women to expect to get a call back because so many women do. Because screening mammography is only 2 views. So take a deep breath. Most of the time, the callback results will be fine. And even if it's not and it requires a biopsy, most of the time it's going to be fine. And even if it requires a biopsy that gives an abnormal result, there's still a chance that it's a false positive if you did not have any symptoms. Now, conversely, if you have breast symptoms and a breast lump and you know things aren't right, that is much higher priority for needing to get in for a diagnostic mammogram. But if there is something wrong in your breast, it's been there for a while. So it's important to not get overly anxious, to be able to think clearly. I mean, anxiety is not good for the body. Get your rest. Eat healthy. Don't start planning your funeral. I mean, everyone is going to die, and we all need to have end of life plans. And we're going to talk about that in future podcasts. But you want to live life to the fullest. And I have so many brave women in my practice that are breast cancer survivors, and they don't miss a beat. And the treatments have improved so much, and dealing with side effects from chemotherapy or just dealing with targeted radiotherapy or more minimally invasive procedures surgically, women could just go on and live their life fully in most cases. So with that, I hope you've been empowered to be strong, be healthy, and be in charge. And I really want to thank you for joining me again in the Sunflower House in October when we're full of those pink ribbons. If you've enjoyed listening to this podcast, please give us a 5-star rating. Please share the podcast with your friends and family. If you're so inclined to make a donation to our nonprofit, you can click the donate button on speakingofwomenshealth.com. Please check out our website for more important breast information. And we'll see you next time in the Sunflower House.